In the last episode of Health Literacy in Real Life, we talked about how to identify where health literacy initiatives are hiding within your organization. Identifying them is actually only step one of a 6 step process for better integrating health literacy across your organization. And in this episode, part two, we're going to dive into the remaining 5 steps. First, a quick reminder that the purpose of bringing health literacy out of hiding by identifying where it sits across departments and by coordinating across departments is not to create more work. The purpose is to connect existing work in order to advance patient outcomes more efficiently and more effectively. If we haven't had the chance to meet yet, I'm Megan Freeland. I'm a public health pharmacist by background, and my work touches on public and population health, health literacy, and patient engagement and education. So let's run down the 6 step process. Number one, you already know, identify. This is essentially an audit where you are finding out what already exists within your organizations. What teams are developing intentionally health literate materials or are following health literacy processes and standards? What departments are developing and launching programs and initiatives that are designed to improve patients' health literacy or that are designed to improve how your organization supports patients' health literacy? You can think of this step as a bit of a scavenger hunt where you are leaning on your relationships across the organization to find out what's going on. Listen to part one of this episode if you haven't yet to get a head start on understanding which departments you want to reach out to and connect with. Since in that episode, we discussed 6 or 7 places where health literacy is often hiding in plain sight within healthcare organizations. Once you feel like you've tapped each of these departments and you've learned what health literacy priorities they have going on, then it's time to map them. So, step two is map. How you go about mapping is going to vary based on what you learned from step one. So, if you found that primarily there are people who are creating health literate materials, it may make sense to map out those materials in a spreadsheet where you organize them by topic, by audience, by owner and department, by channel, like how those materials are being distributed, and by the health literacy standards that are being used to develop the materials. If, on the other hand, you found that there are more programmatic health literacy initiatives across the organization, you'll want to map those accordingly. So maybe you categorize them by purpose, by population, by desired outcomes, by format, so digital or in person, etc. The format of the map is not set in stone. That is not something that is prescriptive. The format of the map should align with whatever it needs to be in order to properly display what you have discovered in step one. And once you have a sense of the health literacy lay of the land in your organization, it's time for the most important and what can admittedly be the most challenging step. Step three, coordinate and align. In order to connect existing work, there has to be infrastructure that brings the people responsible for that work together. Now, what this looks like, again, can vary from one organization to the next. It's largely dependent on how much of a priority health literacy already is for your organization. In an organization where health literacy is more so in its infancy and where buy in from leadership might not be as strong or well established, that type of organization may benefit from a simple cross functional working group or a community of practice where individual employees with an interest in improving organizational health literacy are coming together, they're self organizing. For an organization where the health literacy priority is more well established, this could look like creating a more formalized entity. A great example is a center of excellence where health literacy is prioritized within it. Genentech's new population health center of excellence is a perfect example of this. Also, what types of governance will this group include? That's something important to figure out in this step of coordinating and alignment. In addition to the structure of the coordinated body, you also have to consider who is involved. So, who's going to be on this team? The automatic consideration are the individuals who have historically been leading this work in their respective departments. So, the work that you identified and mapped in steps one and two, those owners are a given. But it's also worth considering which ancillary colleagues may be supportive. It can be helpful, for example, to involve medical, to involve legal, and regulatory colleagues proactively to gain their buy in, and also to ensure that the standards, the processes, the broader governance that you all are creating within this group aligns across organizational priorities. And representatives from those groups usually have a good line of sight into what the broader organizational priorities are. Once you have your team structure in place, your first priority is going to be achieving that alignment. What are your shared goals and objectives? How will your teams work together, and to what extent will you work together to achieve those shared goals? How will you measure the success of the collective? How will you report and share that success? For step three, that was a lot, but honestly, that is just beginning to scratch the surface of the level of detail that you're going to need to go to within that step. And that's why I transparently framed it as the most challenging step. But once you have achieved that coordination and that alignment, and you've built the structure to support it, then you move into step four, which is more of the fun step. It's the execution. You collaborate and you measure. So, working together to execute on your individual team's health literacy initiatives, but in a way that aligns with that broader collective's goals, the goals that you established in step three. It's possible and it's likely that some of the processes or procedures project owners followed before beginning step three will change because of new governance, new standards, or protocols that you established and aligned on within the group. But this is an exciting step because it's how you now begin to see the fruits of your efforts play out. It's how you see that governance in action. You'll also be able to identify places where support might be missing, where there are gaps, and you'll be able to create solutions for those gaps in real time. Now, measurement is a key part of this step because it's the only way to determine the impact of your efforts. What's working, what's not working so great, what stands to be improved. And it helps you improve and make the case for more resources as your work progresses. So remember that this step is not just about collaboration and execution, it's also about measurement. And that brings us to step five, evaluate and iterate. Now, you can evaluate the effectiveness of your collective work in accordance with those success metrics that you laid out. And it's important to ensure that these metrics are not specific to an individual project, an individual deliverable, or an individual program. The metrics we're talking about in this step are not at the project or the program level. Those metrics are still important for the individual owners and for their teams. But for the collective that you've established, whether it's a working group, community of practice, etc., you want to have clear metrics at that group level, and you want to measure and evaluate according to those metrics so that you can iterate and make improvements down the line where it's necessary. I recommend reviewing these metrics at minimum quarterly, depending on the volume that your group is producing, monthly or bi-monthly, every 2 months. That may be warranted, it could be appropriate, but I recommend reviewing these metrics quarterly at minimum and ensuring there's a system for reporting those metrics across the group and beyond the group. One thing that I forgot to mention in the third step of coordinating and aligning, we talked about having individuals from medical, legal, and regulatory there. It can also be helpful to have some type of executive sponsor or a leader within the organization who has some pull, who can serve as an internal advocate for your team. Back to step five, when you come to the step of evaluating and iterating, reporting out those metrics, it's important to not only report out to your team, but to report out more broadly to leaders, including your executive sponsor, who can help advocate for your group with evidence that what you're doing is working and that you all are meeting and exceeding your goals. So, to summarize, here are the 6 steps that you can follow to not only bring health literacy out of hiding in your organization, but to collect health literacy work more seamlessly and effectively. Step 1, identify, find out where those opportunities lie. And step 2, map them. Step 3, coordinate and align with a clear and specific structure and governance. Step 4, collaborate and measure, measuring at the group level, not just at the individual project or program level. Step 5, evaluate and iterate. I know this can seem initially overwhelming, but you can actually start these steps today with a very quick and simple note to your colleagues. It can say something like, "Hi, I'm so and so in XYZ department, and we have been working to improve the ways we incorporate health literacy standards into our work, into our processes. I'm curious to know if anyone else's work is currently touching health literacy in some way. Would love to set up some time to learn more. I think the organization more broadly and patients could benefit tremendously from our collaboration on these efforts." So that way, you've got a message out to your larger organization that lets them know that you are seeking to connect with others who are prioritizing health literacy. And that is how you get the ball rolling. A very simple first step. To close, remember that you are not starting from scratch. You are simply trying to connect the dots of what already exists and strengthening those individual dots, those programs, those initiatives, those materials by creating more of a connected ecosystem between them. And that is the exact spirit of organizational health literacy. Thank you for listening. Please share this episode with a friend or a colleague if you think it might be helpful. And don't forget to subscribe to the Health Literacy in Real Life podcast, either on YouTube or on your favorite podcast platform.